Hello, I'm Professor Stehling. By training, I'm a medical doctor and a physicist. I am the founder and medical director of VITUS Private Clinic in Offenbach, Germany. For more than 10 years now, I have been deeply involved with the subject of prostate cancer. That may not seem like a very long time, but unlike most urologists, I have tried to truly understand prostate cancer instead of blindly following the current treatment guidelines. In the process, many controversial issues have come to light. Like most others, I initially did not question the actual benefits of prostate cancer treatment. Like most doctors and patients, I assumed that cancer must be treated for the patient to survive, or at least to live longer than without treatment. That sounds logical, doesn't it? But on closer examination, it's not hard to discover that most established prostate cancer treatments are largely ineffective. Ineffective? That sounds like nonsense, doesn't it? Cancer is dangerous, and without treatment, the patient will die. So the cancer must be removed to help the patient. Yes, that's what one would think. But the truth is different. On average, 14 out of 15 prostate cancer treatments are ineffective. Only 1 out of 15 men who undergo surgical removal of the prostate actually lives longer because of the operation than he would have without any treatment. That is what the number needed to treat shows, a metric that has been included since 2022 in the S3 guidelines on prostate cancer from the German Society of Urology. But then, why treat at all? There are many reasons. On the one hand, it is what patients expect and what doctors do. Yes, it's that superficial. And 1 in 15 men does benefit. The problem is you don't know who it will be. So everyone gets a chance. And the side effects are essentially socialized, borne by all. And of course, treating also serves to sustain the healthcare system. Doctors and hospitals need to be funded, and urological clinics make most of their money through surgery. And patients usually don't even ask, "Doctor, will the surgery actually help me at all?" That thought doesn't even occur to most of them. The sense of urgency overrides all other considerations. The cancer has to come out as quickly as possible. This mindset is shared by both patients and doctors. Before it spreads, the cancer, maybe it's still inside the capsule and hasn't broken through yet. Yes, this is how doctors and patients think, using these simplified images, almost like kindergarten-level thinking. I've heard thousands of these stories, patients talking about their prostate cancer with general practitioners and urologists. But what's wrong with that? Everything. Cancer takes place at the cellular level. What radiologists and surgeons see is only the macroscopic level, the part of prostate cancer that is directly visible to our senses. Cancer starts and spreads once it reaches the size of a small grain of salt. At this point, blood vessels grow into the cancer cell cluster to supply it with nutrients and oxygen. And as soon as this happens, cancer cells begin to migrate into the vessels and are carried away by the bloodstream. Elsewhere in the body, they attach to the vessel walls and creep into the surrounding connective tissue, where they form micro-metastases, tiny clusters of tumor cells, far too small to be detected by imaging diagnostics. These micro-metastases can survive unnoticed for years, sometimes even decades, until they begin to grow and develop into macroscopic metastases, which are the ones most men with prostate cancer eventually die from. So, surgically removing a macroscopic tumor in the prostate may, at best, prevent future spreading of tumor cells, but it cannot reverse the dissemination of cancer cells that has already been going on for years before the tumor was detected and removed. And most prostate cancers, whether detected via PSA levels or, as should now be standard, through an MRI of the prostate, have already been growing undetected in the patient's body for 5 to 10 years. During all that time, they have been silently spreading cancer cells. And what about the prostate capsule, which is supposed to prevent the tumor from breaking through for as long as possible, like a dam holding back destructive floodwaters? The truth is, the prostate capsule, in that sense, doesn't actually exist. It is made up of connective tissue fibers penetrated by nerves and blood vessels, and it poses no real barrier to mobile cancer cells. Long before it can be detected on a macroscopic level, such as with an MRI scan, that the tumor has grown beyond the prostate, cancer cells have already migrated through the so-called prostate capsule into the surrounding connective tissues. Because cancer cells are incredibly mobile, this was studied at the Radboud University Medical Center in the Netherlands. The result? Cancer cells move in the same way as predators. Once cancer cells have migrated out of the prostate, they settle in the connective tissue surrounding it. And these cancer cells around the prostate are what eventually causes a recurrence, a regrowth of the tumor, long after the prostate has been removed surgically. Still, the issue of local recurrence remains a source of great confusion for most patients and even for many doctors. How can the tumor grow back if it was removed along with the prostate? That's not possible. It's gone. These mistaken and frankly grotesquely oversimplified concepts of cancer as a local ulcer that just needs to be cut out are still the foundation of standard therapies like surgery and radiation. Therapies that do little good but do immense harm. Sad but true. So what's the consequence of all this? Give up and die with dignity? Absolutely not. Successful treatment requires one thing above all: truly understanding what prostate cancer is. Men with prostate cancer die in the overwhelming majority of cases, not from the primary tumor, but from metastases. So the goal of any treatment that truly saves lives must be to prevent the formation of macroscopic metastases. And since micro-metastases have already formed by the time the prostate cancer is diagnosed, the task is clear. The micrometastases must be destroyed. But how? It has long been known that the body's own immune system can identify and destroy cancer cells, just as it does with bacteria and viruses. The problem is, on its own, the immune system is too weak to handle this task. It needs support. And today, this support is available in the form of immunotherapy. But wait, isn't prostate cancer an immunologically cold tumor? A type of cancer that does not respond to immunotherapy because it is especially good at hiding from the immune system, making itself effectively invisible? Correct. But there are ways to strip prostate cancer of its invisibility cloak. Two approaches have proven effective for this: abscopal therapy techniques such as irreversible electroporation, IRE, electrochemotherapy, ECT, and photodynamic therapy, and modulation of the tumor microenvironment. These methods can make prostate cancer visible to the immune system again, turning a cold tumor into a hot one, and enable the immune system to attack and destroy not only the primary tumor, but also the micro-metastases throughout the body. Abscopal therapies work by releasing tumor antigens through the destruction of tumor cells within the body. Tumor antigens are protein structures in and on the tumor cells that allow the immune system to recognize them as dangerous. Abscopal therapy techniques therefore function, in principle, like a vaccine, where antigens are introduced into the body to trigger the immune system against viruses or bacteria. In contrast, surgical procedures remove the tumor along with the tumor antigens from the body. This deprives the immune system of the critical signal. No immune stimulation occurs. Similarly, treatments that use heat to destroy the tumor, such as HIFU, high-intensity focused ultrasound, radiofrequency ablation, or laser techniques, denature and destroy the tumor antigens through the high temperatures. By contrast, destroying the primary tumor with abscopal techniques triggers an immune response against the tumor throughout the body. This can be observed when, for example, a prostate tumor is treated with IRE, irreversible electroporation, and the patient already has lymph node metastases. After the tumor in the prostate is destroyed with IRE, changes are also seen in the lymph node metastases, even though they were not treated directly. They shrink and show reduced activity on MRI and PET scans. This remote effect is the abscopal effect of IRE treatments. Unfortunately, the abscopal effect alone is not strong enough to completely destroy all tumor cells spread throughout the body. That's because cancer cells can actively defend themselves against immune attacks. They send signals to the attacking immune cells, telling them to stop, claiming they are not cancerous, but harmless benign cells. This communication happens via so-called checkpoints, receptors and matching ligands, like a lock and key. Modern immunotherapeutics interfere with this communication between the tumor and the immune system. They block the stop signals with checkpoint inhibitors, allowing the immune cells to continue their attack. This leads to a much stronger immune response against the tumor cells. But as I mentioned earlier, there's another approach to turning prostate cancer from an immunologically cold into a hot tumor, one that responds to immunotherapy. It is also possible to influence the interaction between the tumor and the immune system within the tumor itself. Small doses of certain chemotherapeutic agents, such as docetaxel, a drug derived from compounds found in the jute trees, can block specific immune cells that would otherwise suppress the activity of the immune cells meant to attack the tumor. Checks and balances. The principle that protects democracies from turning into dictatorships also applies to the immune system, preventing it from becoming a threat to the body itself. However, within the tumor, in what is known as the tumor microenvironment, the microscopic surroundings of the tumor, cancer cells exploit these regulatory mechanisms to shield themselves from immune attacks. Docetaxel disrupts this protective mechanism. To make these drugs, which modulate the tumor microenvironment, effective in small amounts but at high local concentrations, they are injected directly into the tumor. This is done with high precision, guided by CT or ultrasound imaging. As a result, systemic side effects are largely avoided. So, what do all these insights mean for men with prostate cancer? Well, better chances of survival. Because by combining abscopal therapies with immunotherapeutics, it is possible not only to treat existing metastases, but also to prevent the formation of new ones. This is becoming increasingly evident through a growing number of scientific studies. When primary tumors are not removed surgically, but instead treated with abscopal tissue ablation methods in combination with immunotherapy, the development of metastases over the course of the disease occurs less frequently. This is because immunotherapy is able to destroy micro-metastases before they have a chance to grow into destructive macro-metastases. At the VITUS Private Clinic, we have been successfully using these modern and highly advanced treatment methods for several years. But immunotherapy also has its downsides. On the one hand, immunotherapy does not work for every patient. On the one hand, it can lead to autoimmune side effects, where the unleashed immune system attacks healthy organs such as the lungs, kidneys, heart, or skin. And immunotherapeutics are expensive. Let's first take a look at why immunotherapy doesn't always work. It has to do with the presence of specific receptors on both immune cells and tumor cells. These receptors can sometimes be detected in tissue samples or in the blood, but that still doesn't guarantee that immune therapy will be effective. Why not? Because these receptors might be present in some parts of the tumor, but absent in others, and they can develop or disappear over time depending on the tumor's evolution and the influence of the surrounding tissue environment. On the other hand, immunotherapy can also backfire. In addition to attacking the tumor, the unleashed immune system may also target healthy tissues and organs. That's why immunotherapy must be closely monitored so that autoimmune side effects can be detected and treated early. Fortunately, these side effects occur mainly with the long-term use of immunotherapeutic agents, which is rare in combination with abscopal therapies. Yes, it's a complex field and one that is constantly evolving. But it also represents a major opportunity for all men currently affected by prostate cancer. The likelihood of dying from prostate cancer is steadily declining. Even today, there is already a wide range of effective and gentle treatment options available. Abscopal techniques like IRE, immunotherapy, and radioligand therapy are increasingly proving to be leading approaches. Personally, I believe that within the next 5 to 10 years, we will see a definitive solution to the problem of prostate cancer. The use of artificial intelligence is currently accelerating medical research at an unprecedented rate. Men with prostate cancer today have a very good chance of benefiting from these future treatments. Until then, the goal is to keep the cancer under control with as few side effects as possible. That's where I and my team at the VITUS Private Clinic can help you. Get in touch for a consultation. It could improve your quality of life.